Hi guys, it's me, Tinmay Arcenas, and welcome back to my channel. So, for today's video, I'll be sharing my PCOS or Polycystic Ovarian Syndrome journey. And I know it's very personal to share such health condition, but I feel the need to share my journey on how I became PCOS-free because I know a lot of women are also experiencing or suffering from this condition. But first, we need to know and understand everything about PCOS, its definition, its cause, what are the signs and symptoms, diagnosis, and of course, treatment and management. So, ano nga ba talaga ang PCOS or ano nga ba talaga yung Polycystic Ovarian Syndrome? PCOS or Polycystic Ovarian Syndrome is a genetic, metabolic, hormonal, and reproductive disorder which is common among women of reproductive age. Karamihan sa mga cases nito, mga nasa 20s to 30s yung age, pero as early as 15, nagsistart yung ganitong condition. Etong PCOS na to is said to be the leading cause of infertility sa women dahil nga sa presence ng multiple cysts or polycysts sa ovaries, the ovaries might fail to function regularly. Yung ovaries kasi natin, yung responsible to produce eggs for fertilization, and it also produces female reproductive hormones called estrogen and progesterone. When you have PCOS or when you have this condition, your hormones are out of balance. So dito sa PCOS, mas marami yung mga male hormones na naproproduce na tinatawag nating androgens kaysa ating female hormones, which is hindi normal para sa ating mga babae. Pero ano nga ba yung etiology or cause ng condition na to or nitong PCOS? Actually, yung cause nito is still unknown, but there are factors that may play a role such as hereditary. Minsan namamana daw to kasi merong research na may mga certain genes na nalilink dito sa PCOS na condition. So, tanungin nyo yung mama nyo or yung sisters nyo kung meron silang history ng PCOS or meron silang PCOS. So, pwedeng mag-contribute din yan or pwede yan maging factor ng condition mo kung meron ka yan. And next is poor lifestyle. Kung sedentary yung lifestyle mo, wala kang masyadong ginagawang activity. Yung hormones natin hindi nare-regulate kung walang masyado tayong ginagawang activities. Tapos yung kinakain mo hindi healthy. So, pwede din yan maging contributing factor sa condition mo. And then yung excess insulin. Ilan lamang yan sa mga contributing factors ng condition na to. Marami pang ibang factors na nalilink dito sa PCOS condition. Ngayon, alamin naman natin yung mga signs and symptoms ng Polycystic Ovarian Syndrome. First, yung excess male hormones which is yung androgen hormones. Pag masyadong mataas yung male hormone natin, this may cause severe acne, male pattern baldness, hirsutism, or yung excess facial and body hair. Second ay pag meron kang irregular periods, either prolonged menstrual cycle or infrequent menstruation. Yun yung mga hindi normal na pagregla. Halimbawa, 3 to 6 months or buong taon kang riniregla, so masyadong mahaba yung period mo or yung menstrual cycle mo. Or minsan naman, kung hindi ka talaga dinadatnan, ilang months na or buong taon, hindi ka pa rin nagkaka-period. Next ay infertilities. Ito medyo common to sa may mga PCOS and ang dami kong kakilala na hindi sila nakaka-conceive ng baby or nakakabuo ng baby dahil meron silang PCOS. Though yung PCOS is the leading cause of infertility sa women, pero good news kasi treatable naman talaga yung condition na to. Pero bakit nga ba nakaka-cause ng infertility yung Polycystic Ovarian Syndrome? It's because when you have PCOS, your hormones are out of balance. So, pag meron kang hormonal imbalance, makaka-interfere yon sa growth and pag-release ng eggs from the ovary. So yun yung tinatawag nating ovulation. So, pag hindi maka-ovulate yung babae, hindi ka din makaka-conceive ng baby o hindi ka din mabubuntis. Kung meron kayong kakilala na hindi nakaka-conceive ng baby or hindi nabubuntis, wag natin silang i-pressure na magbuntis kasi hindi natin alam yung mga pinagdadaanan nila. Mali natin meron silang pinagdadaan ng ganitong condition kaya hindi sila maka-conceive ng baby. At sa mga babae na hindi pa nakakabuo ng baby, treatable naman tong condition na to. Magpaalaga lang kayo sa right person. Lagi niyong tandaan na it doesn't make you less of a person, it doesn't make you less of a woman. Next ay anxiety and depression. So, pag meron kang hindi normal na nararamdaman or nai-experience sa katawan mo, sa body mo, na-feel mo yan, nakikita mo yan, it can negatively affect your emotions. Next ay obesity. So, karamihan sa mga kakilala ko na may PCOS ay matataba, pero hindi ibig sabihin na pag mataba ka, meron ka ng PCOS, at hindi rin ibig sabihin na pag payat ka, hindi ka na magkaka-PCOS. In fact, meron din akong kakilala na super sexy niya, pero positive din siya for PCOS. Yun nga lang, yung pagiging obese or yung obesity can worsen the complications of the disorder. Personally, yung na-experience ko na signs and symptoms ay yung severe acne, anxiety, severe dysmenorrhea, excess leg hair, parang nagki-curl yung hair sa legs ko, parang sa lalaki, and then yung spotting. Yung spotting experience ko, normal kasi yung menstruation period ko, yung menstrual cycle ko, normal lahat. Since nag-mens ako, never naging irregular yung period ko. Pero bigla ako nag-spotting, and at first, kala ko normal lang. And meron ako mga kakilala din nagsa-spotting sila, pero parang nawawala lang din. So, in-ignore ko lang yun, hindi ko yun pinansin kasi kala ko mawawala lang. Pero nagpatuloy siya siguro mga 3 to 6 months na nagsa-spotting ako. So, naisip ko na parang hindi na normal yung nangyayaring spotting sa akin. Then, dumating yung time na period ka na. So, before, meron akong mga episodes of dysmenorrhea, pero namamanage pa rin yung pain. Minsan, nagtitake ako ng Buscopan Venus, minsan, dinalagyan ko ng hot packs. Pero itong period na to, as in, hindi siya na-manage ng medicine, hindi siya na-manage ng hot packs or kahit natulog ako, sobrang sakit pa rin talaga niya. Kahit anong i-take ko, kahit anong gawin ko, so hindi nawawala yung pain. Whole day yung constant pain, whole day yung pag-iyak ko, whole day yung pag-suffer ko sa pain na yun. So, yun yung nag-push sa akin to see an expert, a specialist, a doctor. And yung right person to consult is an OB-GYN who is an expert in female reproductive medicine. Yung OB-GYN yung right person to consult pag meron tayong nai-experience na mga ganitong signs and symptoms. So, yun, the next week after my menstruation, I went to Cebu for consultation because the earlier the detection, the better. Pagdating ko sa OB-GYN ko, we had discussion of my medical history. Tinanong niya yung mga signs and symptoms na na-experience ko, for how long ko na daw ito na-experience. Tinanong niya yung lifestyle ko, mga stressors, and yung last period ko. And marami pang iba na tinanong sa akin yung doctor ko. And advice ko lang sa inyo na when it comes to giving information to your doctor, maging honest kayo para mas ma-assess kayo ng mabuti, and that way, mabibigyan kanya ng better treatment and management. And of course, meron din physical exam. Tinignan niya kung meron akong severe acne, excess hair growth, and marami pang iba. So, after nun, binigyan niya ako ng request for ultrasound to check the appearance of my ovaries and thickness of the lining of my uterus. And yun na nga, lumabas yung result ng ultrasound, and I was tested positive for PCOS. And after ko makuha yung result ng ultrasound, bumalik ako sa OB-GYN ko for thorough explanation and interpretation ng ultrasound at ng condition ko. So, sa ultrasound, makikita nyo dun na meron siyang polycystic pattern or multiple cysts na andun sa ovaries mo. So, mga bilog-bilog siya. Yung sa akin, yung left and right ovaries ko, positive siya for polycyst or meron siyang polycystic pattern or polycystic background. Yun yung makikita mo sa ultrasound, yung parang mga bilog-bilog na andun sa ovaries mo. Nung andun ako sa OB-GYN ko for explanation and interpretation nga ng condition ko, inaintindi niya sa akin ng mabuti, in-explain niya sa akin ng mabuti yung ganitong condition, diniscuss niya sa akin yung better treatment and management para sa condition ko. So, in-address ng OB-GYN ko yung mga concerns ko regarding this condition. Nung kinonfirm na sa akin ng OB-GYN ko na I was positive for PCOS, sobrang depressing talaga, ang daming questions, ang daming what-ifs na pumasok sa isip ko. To think na meron kang ganitong condition na pwedeng makahinder and maka-interfere sa pagbuo ng baby, lalong-lalo na gusto kong magka-baby, gusto kong mag-start ng family. Pero yung OB-GYN ko, in-explain niya sa akin ng mabuti, pinaintindi niya sa akin nitong condition na treatable naman to. Minsan, may mga ibang OB-GYN na nagre-request sila for blood test to measure your hormone levels, glucose tolerance, fasting cholesterol, and triglyceride levels. Pero sa akin, hindi na nag-request ng blood test yung OB-GYN ko. Yung physical exam and ultrasound na lang yung ginawa sa akin for diagnosis. So now, I'll be sharing how I managed my Polycystic Ovarian Syndrome with the help of my OB-GYN. So, my OB-GYN gave me pills to regulate my hormones and to correct my abnormal bleeding, yung pagsaspotting ko. And I was advised to take the pills for 3 months. And aside from the medicine or the pharmacological treatment, she also gave me a lifestyle intervention, and that includes lifestyle modification, doing physical activity, doing exercises, workout, and having a balanced diet or a healthy diet. Pagkalabas ko sa clinic ng doctor ko, tinake ko seriously yung condition na yon in a positive way kasi gusto kong magka-baby, gusto kong maging normal yung body ko, and gusto kong mag-heal from this condition. Gusto kong maging healthy. More on lifestyle modification talaga yung management ng PCOS condition. So first, sa physical activity. So yung ginawa ko, at least 30 to 40 minutes a day, 3 to 5 times a week, and more on cardio exercises yung ginagawa ko. Pero bakit kailangan ng isang PCOS patient na meron kang physical activity? Kasi being active and having regular exercise help you keep your weight under control, and at the same time, nare-regulate yung hormones mo pag meron kang physical activity. So sa diet naman yung ginawa ko, kinat ko yung rice, yung bread, kinat ko yung beef, chicken, pork, no sugary drinks, no coffee, no soft drinks, no junk foods, no chocolates, and no dairy products. So, yun yung nag-strict talaga ako sa diet ko kasi gusto kong mag-heal. Yung mga kinakain ko lang, root crops or saba banana. Sa root crops, usually yung sweet potato or kamote, and then ina-alternate ko lang yung saba banana at saka kamote. Yun yung pang-substitute ko sa rice para hindi manghina yung katawan ko. And then more fruits and vegetables, fish, and then more water. Gumagawa din ako ng organic turmeric tea at iniinom ko to every morning for 3 months because of its anti-inflammatory and antioxidant properties. So, yun yung ginawa kong lifestyle change, lifestyle modification, more on being active and eating healthy food. So, after 3 months of being consistent and committed to my healthy lifestyle, bumalik ako sa OB-GYN ko for my follow-up check-up and para makita kung merong improvement or progress sa condition ko. So, nagpa-ultrasound ako ulit. Nag-request yung OB-GYN ko for another ultrasound. And fortunately, no pattern or background of polycyst na sa ovaries ko. And the moment na nakuha ko yung result and kinonfirm sa akin ng OB-GYN ko na wala ng polycyst background or pattern sa ovaries ko, overwhelming yung feeling. Overwhelming talaga yung result na finally na-heal na yung condition ko in just 3 months. And na-remember ko pa nun, kasama ko yung husband ko sa pagpa-check up and kasama ko siya sa pagkuha ng result. Sobrang saya namin, as in, naiiyak ako sa tuwa. Hindi namin ma-express yung happiness namin that time kasi naging PCOS free na nga ako. And worth it yung mga ginawa kong lifestyle modification, worth it yung treatment. So that's another answered prayer, and God is indeed our ultimate healer, and all things you ask in prayer, you will receive. So, lagi nating isama si God sa journey natin, in happiness or sorrows man yan. Kung nalampasan ko man and nag-heal ako from this condition, I know malalampasan mo din yan and mag-heal ka din. You just have to trust the process, do your part, and God will do the rest. So, that's it guys for today's video. I hope you find this video helpful. Don't forget to leave a comment if you have questions, requests, and recommendations, and subscribe to my channel, Tinmay Arcenas, and click the bell button beside it so you'll be notified whenever I post a new video. Thank you guys for watching this video, and I hope to see you in my next one. Bye!